I'm going to be describing my role basically, which has been around since 2004, but it's evolved quite into quite a wider role than it initially started off as. It's been received a couple of national awards actually, so it's been doing quite well, and it's about working with young parents that are quite vulnerable.
So tell us a bit more about the detail of your work. On an everyday basis, what are you up to?
Right, on an everyday basis, I can be seeing clients one-to-one in their own homes, and it can be giving them additional support with parenting or additional support with all aspects of becoming parents. I tend to work with clients from quite early antenatally, and so it can be sort of about building up a relationship with them and supporting them through the pregnancy with their partners, helping them around sort of multiple issues really, which can be housing, it can be substance misuse, it can be it's a lot about directing them to other services, so it's very much a public health focused role, and very much a sort of hands-off role in a way, but it's about leading them and helping them find where they want to go for services themselves and supporting them in that. So it's about moving young parents on really.
And what's the feedback you've got from your clients?
I've had lots of good feedback. Actually, I got a Queen's Nurse Award last year in recognition of practice, which is actually that comes around from client feedback, so that was a nice thing to get. The clients initially can be quite hard to engage because they've come from quite complex backgrounds. But once you actually get them on board, they can actually then be, very, very receptive to support.
And they see the benefits of the advice and the extra help you're giving them.
Yeah.
What does the future hold for this project? So you've taken it here, you've got the awards, where do you go?
Yeah, where I go now is actually the role rolled out to across Rother. It was just initially Hastings and St Leonard's, and in July last year it went across Rother. There's now a more of a focus. I think I need to focus more on the rural areas, different sorts of problems, different issues, but there is a need to sort of look at those groups there more. And in Hastings there's actually a government pilot that's going to be coming on board in September this year, and that's called the Family Nurse Partnership, and that's going to be focusing very much on teenage parents.